Hi, again, I'm Tara. I'm one of the respiratory therapists. So in the other video, we talked about using a non-rebreather in addition to either a heated high-flow nasal cannula or a regular high-flow nasal cannula as we're treating COVID patients. So from there, if you start to notice with your assessment that that's not working for the patient anymore, so if they are starting to lose what would be a clear ventation, if they're really starting to work to breathe, so that ventilatory process, not just the saturations, but if they're really starting to have a hard time ventilating as well, and we're not keeping their sats up, what we can do is move to a CPAP. And so rather than BiPAP, we're actually just going to use CPAP settings in the ranges from about 8 to 12 centimeters of water pressure. So again, with these patients, you've kind of already tried the other modalities with the non-rebreather, the heated high flow. With those patients, you can have already tried proning. That works a lot to bring up those saturations. And then the other thing is remembering to be okay with lower saturations down to 82 or 84% is acceptable. But again, we don't want, if you need to move on from there, that's okay. This is where we would go. So we would start with, like I said, a CPAP on the lower end, about 8. And what we're using is a viral bacterial filter over the exhalation valve. So, and that'll help protect from the aerosolization into the room. So this is our patient that we've already tried on the other supplemental oxygen, and now we're just going to go with a non-invasive. I'm going to put this on. And I'm starting here with a CPAP of 8. These patients are usually pretty anxious by this time, so we've really been working hard to kind of talk them into just letting the device do its job, letting it push the air in. And this is all to avoid intubation. So these are all the steps we're going to take before we consider intubation. We only want to consider intubation if we really are looking at full-blown respiratory failure and we're unable to maintain acceptable saturations for longer periods of time.